Chairman, thank you. Thank you for having this hearing today. And Ms. Sanchez, thank you for the role you played in bringing this important matter to the forefront. And thanks to all the witnesses who are here. You all have done an outstanding job. And in particular, Ms. Brown, thank you. What a courageous story of dedication and love and commitment. Sadly, a story that you shouldn't have to tell because you shouldn't have to have done that. But you're a very impressive young woman for the role that you took. I'd like to talk a little bit about hospice. And I've heard from hospice in my district that a lot, but the one thing that keeps, and one problem that keeps coming up is workforce shortages. And you know, the labor shortages are a challenge to all of healthcare, as we know. Provider shortages, nursing shortages, caregiver shortages, and hospice is far from immune. The problem is particularly acute in the rural parts of my district, and I'm assuming that is the same across the country. So, Mr. Banash, I'd like to ask you, could you talk a little bit about those workforce shortages and the effect that both to access to hospice care and the quality of care?
Thank you for the question, Congressman Thompson. Indeed, I think access is strained when the number of caregivers and folks that are available to care for the population is shrinking and the population is growing. Hospice is an interdisciplinary model, so with hospice, it's even worse because you're not only talking about the shortage of physicians and nurses and social workers and therapists and aides, you're talking about the shortage of all of them. There are a couple things that we can do. One involves training. PACHITA is a bill that actually was passed by the House that would provide better training on hospice and palliative care. And the other thing is really taking a look at the pay that we provide to some of these folks. It is difficult for a hospice and many care providers to compete with a packaging plant where you can earn $20 an hour putting books in boxes when the far more arduous work of being a hospice aide is stacked up against it. So I think we have to make some priorities in this society, and I think prioritize caregivers, prioritize home health aides and other aides that provide those services, as well as providing more training to physicians and nurses and social workers.
Thank you. I also hear the impact that cost of living has, and it speaks directly to the issue of pay. You know, I have some people who are driving 90 minutes both ways just to be able to provide hospice care and afford to live. So I think you're spot on.
And that's especially acute in California and places like that. Absolutely.
Mr. Malone, do you have the same problems in the skilled nursing facilities that we have in hospice?
Yeah, well, I think that especially when the economy is good, we see that there's more pressure on healthcare. We see that in nursing homes because nursing homes are historically a really poor place to work. They're the most dangerous profession now is being a nurse aide. It's often a thankless job. We've done studies over the years that looked at working conditions, and that, I mean, salary is important. When someone can make the same amount of money working at McDonald's or working in a packaging plant than they can caring for a resident, and they're not allowed to care for that resident because there's so little staffing and there's so much pressure and it's such a bad environment that they'll choose the other, or there's the turnover again that they'll leave. So it is a huge issue.
Thank you. And I'd like to talk about something else, another problem. My district has recently been devastated by fires over the course of the last 4 years. And as a result, we have had constituents who've had their power shut off for days on end. And I just heard from a hospice in my district where the power had been shut off for 8 days in 30-degree weather. It was so bad that they had clients who had to go sometimes with medical equipment attached to them and sit in their cars just to get warm. It's not just a California problem. I know Florida had similar problems in their hurricanes. Mr. Bianch, what sort of things can Congress do to make hospice and any elder care facilities more resilient or more prepared for natural disasters?
Thank you for the question. The National Hospice and Palliative Care Organization has a foundation that actually provides support for some of these hospices when the disaster sort of hits, but I think it's clearly insufficient. When you look at disaster relief funds that are released, they don't help hospices, they don't help these healthcare providers actually deal with the consequences of a shutdown. They don't buy the supplies that they need to supply power during a shutdown. And I think one thing we do need to look at is prioritizing support as we see disasters. Seemingly every month we see a different disaster of a different sort. I think we need to prioritize the flow of disaster relief fund to help healthcare providers really keep going.
Thank you. I'd like to talk to you offline.
I would love
some
that.
things.
Thank you.